And in that hearing today, CDC Director Rochelle Walensky warned of what she calls a dramatic increase in the Delta variant, saying it now makes up 83% of all COVID cases in the United States. That's up from 50% at the beginning of the month. But she maintains that schools absolutely must reopen this fall, renewing CDC guidance that unvaccinated students wear masks. So let's bring in infectious disease specialist and ABC News medical contributor, Dr. John Brownstein, for more on this. Dr. Brownstein, thanks for being here. One thing we didn't hear from Dr. Walensky today was anything about the American Academy of Pediatrics recommendation that everyone should wear masks in schools, as opposed to the CDC guidelines that only vaccinated students and teachers don't have to. So how should parents and school officials sort through this?
Yeah, thanks, Diane. It's a confusing one, and I understand the American Academy of Pediatrics took a conservative approach. They want to protect our kids, and it's very hard to understand, or to document which kids are going to be vaccinated, which are not. But I think overall, at this stage in the pandemic, we need a lot more flexibility in terms of recommendations. There's huge variations by regions in vaccination rates and risk by age and case counts. Blanket recommendations are not going to work, as is rejecting mask mandates overall as well. I think we need to have nuance. I think we need to be data-driven. And for certain states that are seeing cases really drop dramatically, I think you can start to remove these layers of protection like masking. But in states where you have a surge, masking is going to be super important. And of course, our younger kids that are not yet vaccinated, I think, especially in a hotspot, masking will be important. But it's all going to be about flexibility here.
Now, especially after so many students have been home for so long, Walensky says she's worried about general respiratory infections in schools, and she's stressing that testing is going to be key to determining what's a cold and what's COVID. How hard will that be to navigate, and how can schools start preparing for that now?
Yeah, it's going to be very complicated. I mean, especially with Delta variant, which is changing the game in terms of how schools are going to cope with surges of cases. And as we know, the CDC is saying that it's not a one-size-fits-all in terms of response to the pandemic. And it's going to be all about layers of protection, masking, ventilation, and of course, social distancing, and then testing. Testing has been our key to this pandemic from the beginning to understand what's happening, but also it's a key to get out of the pandemic. With knowing which viruses are causing infection will help understand how to approach a potential outbreak in the school. And it's all going to be about taking that data and making important recommendations based on it. But yes, because of all these lifting of recommendations, we're going to see the increase of colds and flu. And I'm worried that we're going to actually see a pretty bad respiratory season with all these viruses circulating.
Now, officials said immunity from the vaccine will wane over time and that eventually we may need booster shots to stay protected. And you heard Senator Mitt Romney there, frustrated that health officials aren't, in his opinion, moving fast enough to make those boosters available to the more vulnerable. So what do you think? Should there be more urgency around boosters given how quickly the Delta variant is spreading right now?
I mean, absolutely, we need to be considering it, right? The premise is that vaccine efficacy wanes over months because, the protection you get from the vaccine starts to wear off. And yes, lab data does show that a booster can really increase your protection. But you got to remember, the real world data is showing really amazing efficacy of these vaccines. It's reducing hospitalizations and deaths. And so it's not necessarily creating that same urgency. I think that targeted measures around boosters for those that are immunocompromised, elderly, especially the ones that are seeing sort of that immunity wane. We're seeing that a little bit in the UK with the rise in hospitalization. I do think that it's important to create these targeted guidances. I think we have probably enough data to start to move in that direction. But overall, of course, boosters should not be part of the conversation. It's really about getting those unvaccinated people immunized and, of course, global vaccine equity, making sure that we're getting vaccines to the rest of the world at this point as well.
Now, we're seeing more and more fully vaccinated people test positive, including a White House staffer and a spokesperson for Speaker Pelosi. But Dr. Fauci says when you hear about a breakthrough infection, that doesn't mean the vaccine is failing. Can you expand on that?
Yeah, this is a complicated one because we keep hearing these anecdotal stories of people getting infected. Remember, we have 160 million people immunized. We're going to see, breakthrough infections happen more and more. This is not because the vaccines are failing. It's just, we know that every vaccine is not 100%. And because Delta is emerging, we are going to see cases. This is especially going to be true in government officials or sports teams that get a lot of testing. You're just going to, if you look more closely, you will see, these breakthroughs. We don't do this for other viruses. viruses like the flu, so we probably miss a lot of breakthrough infections. So people have to start rewiring their brains to really understand that this virus is probably endemic, that every breakthrough case is not a big deal. And remember that these vaccinations are doing what they're supposed to, which is reducing hospitalizations, reducing risk of death. And that's really what we're aiming for, and that's what we're seeing right now happen in the population.
All right, Dr. John Brownstein, always great to have you. Thank you.
Thanks so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.